you can also see my screen. You can just say a yes in the chat box, or you can respond with a thumbs up also. Okay, great. Thank you for the confirmation. Now, welcome to our Essentials Concept Clarity series. So far, we've had so many sessions on different subjects of psychology, like general psychology, stats and research, biopsychology, and so on. And today, we'll be covering one of the most loved subjects. Can you guess which one it is? It is one of the subjects that students love studying about. What is your favorite subject in psychology?
Psychopathology.
Yeah, yes, it is. Shreya, you're absolutely correct. And yes, psychopathology, that's the correct subject. And especially with MPhil entrances, psychopathology carries a very huge weightage. This is why we will be dedicating a lot of time to today's class. Yes. So this is going to be our last subject as a part of the Essentials Concept Clarity series, but we are planning to bring in more sessions for you all. One session on biopsychology we are planning, and another session on just MCQ practice we are planning, because so far we've understood the concept, we have seen the theory part, but MCQ practice is a different thing. In our previous sessions, we have solved about 10 MCQs each, but then we are planning to dedicate a separate session just for MCQ practice, where we'll have mixed MCQs from various units, because that also challenges you more and more. So it will be a very fun and interactive thing. Yes. And it'll be great if you all could use the chat box. Sometimes when the resource person is speaking, it can be a little distracting for them. They might lose their trail of thought. So raising your hand or typing in the chat box is always helpful. And yes, you are allowed to answer by unmuting your mic if the resource person allows. Yes. Okay, so with this, I also want to share one small thing with you before we begin our class, that as you know, our M.Clin.Psy, which is previously MPhil, and the combined UGC NET preparation course is beginning in just 2 weeks from now on. And the early bird seats are almost about to get full. I think the last 10, 11 seats are left. So if you're someone who is preparing for M.Clin.Psy 2027 or UGC NET, the December intake, then this course is going to help you complete the entire syllabus. We have different resource persons with their own subject matter expertise, and we've had a lot of sessions with each one of them previously to help you understand what their teaching style and pattern is. Also, like, you will get mock tests, you will get the entire syllabus completion through our study material, through PPTs, notes, MCQ practice, exam-oriented guidance, doubt resolution, revision, everything will be there. Even recorded sessions are available. So if anybody is interested, you can just reach out to either me or Manvi for the details regarding the same. Yes. And can't wait for the batch to start, Vijeta. Yes, even we can't. Even I'm honestly excited to teach you personally. And mentorship. So we have different mentors from different institutes who will be telling you about the kind of questions that their specific university asks, because this is not like a one size fits all approach, right? Every institute has its own pattern, its own way of asking questions, so they will guide you on the basis of that. All right, so let's begin with today's session. I would like to introduce the resource person for today, who is Ms. Riya Kashyap, and she is about to complete her MPhil in Clinical Psychology from NFSU. She secured an Air 8 over there, and she's also cleared the entrance for GBU. She has been a gold medalist and a silver medalist during her bachelor's and master's years. And Manvi and I have interacted with her a lot, and we personally love her teaching style. I feel that she's one of those resource persons who can simplify even the most complex topics for you by giving you so many relatable examples from your own daily life. So hopefully by the end of the session, you will get great clarity, because Miss Ria is a great resource person, and you will see that too. So yes, over to you.
Hello, everyone. Thank you so much, Vidhi, for introducing me so well. Let me just share my screen. Okay, so I hope my audio and video is visible to everyone. Can someone please confirm in the chat box? Okay, thank you so much, everyone. Okay, so good evening, everyone. My name is Ria. I am currently in my last few months of MPhil Clinical Psychology from NFSU Delhi. I am your resource person for teaching abnormal psychology, whether you call it clinical psychology, psychopathology, anything. So, before we begin, I want you all to answer a very simple question in the chat. Have you ever thought you heard a phone vibrate, but when you checked, there was no notification? Have you experienced something like this?
Yes.
Yes, yes, I experienced it so many times because being in the hospital, we get so many messages from patients, from faculties, from supervisors, from your friends, colleagues, everyone. And I keep being stuck to my phone that I'm getting a notification. So, yes, most of you said yes. So, this is very interesting. Now, I have another question. Have you ever been walking alone at night and suddenly felt that someone was behind you, but when you turned around, there was no one? Has this happened with a few of you? Yes. Or maybe you looked at a pile of clothes in a dark room and for a moment you thought it was a person, like after watching a horror movie? Yes. Yes, definitely. So what do all these experiences have in common? Your eyes are working, your ears are working, but your brain interpreted reality in a particular way. And that's what today's session is about. Okay, so how perception can sometimes become distorted, altered, or can disconnect us from reality is what we are going to study about. So this is what we call disorders of perception. Okay, so now if you're preparing for CUET PG, UGC NET, GATE Psychology, MA psychology entrances, or the clinical psychology entrances, which is now M.Clin.Psy. This is extremely important topic because questions from hallucinations, illusions, and perceptual abnormalities appear repeatedly in exams. By the end of today's class, I really hope that we'll be able to answer questions confidently, like what is perception? What is the difference between illusion and hallucination? What are the major disorders of perception asked in psychology inferences? But before we talk about disorders of perception, we have to understand the first most important thing, the most basic of what we have to understand is what is perception and can perception ever be completely objective? Okay, so let's see. Okay, so before discussing the definition, if I ask you to place a lemon in your hand right now, what happens? You'll see it, you will smell it, you will also touch it, right? Now imagine cutting the lemon and squeezing it into your mouth. Did anyone remember or feel how it tastes in your mouth, like very bitter and sour in the mouth, right? Interesting. There was no actual lemon here, but yet your brain was able to create this experience. How fascinating, right? Yes. So let's understand what happened. The lemon itself is not perception. The taste receptors, smell receptors, and the visual receptors that you were using, they were receiving all sorts of information. This is what we call sensation, which is something which will be widely covered in cognitive psychology and topics like that. Okay, but when your brain says this is a lemon, it will be sour. I remember its taste. This is all about perception. Can sensation occur without perception? What do you think? Can a sensation occur without perception? Yes, sensations can occur without perception as well. However, information can reach the sensory organs, but unless the brain organizes this information or interprets it, meaningful perception doesn't occur. Okay. So now from what psychologists have defined perception, it is a process by which we organize, identify, and interpret sensory information. Okay, so we are becoming aware of it, we are interpreting those, and we are understanding it through the stimulations which have happened in our sensory organs. These are experiences from our immediate experiences of the immediate world around us. Okay, so from what we've discussed so far, sensation gives us data and perceptions gives meaning to those data. Okay, so sensation, we can say that sensation, give me a second. This. Sensation is detection, whereas perception is interpretation. Right? So with sensations, we are detecting, and with perception, we are interpreting. This is the utmost highly memorable thing that you can remember for your entrances exams. These are certain small memory tips which help understand when a difficult question is in front of you. When your phone rings in another room, what reaches your ears? It's the sound. Okay, so that is what we call sensation. So our ears are detecting it. Okay, but when your brain recognizes that it's my ringtone, it's my phone which is ringing, that is what we call perception. Okay, now let's see how a lot of psychologists have gradually understood perception. First of all, there is William Wundt, one of the most reputed and the most important founding figure of psychology. Wundt was interested in understanding sensation and conscious experiences. How does conscious experiences or being aware and being in present arise from sensory input? So whenever a sensory input is taken, we become consciously aware about it. So if I'm seeing an apple, I will perceive it as an apple because I am being aware about it, and it is something that is present in the current moment. Okay, not going a lot into depth of this because this is covered in other subjects. Okay, our primary focus here is abnormal psychology. Although we have other psychologists as well, we have Helmholtz, who gave a revolutionary idea. He also did a lot of experiments. He said that perception is not passive. Your brain is constantly making educated guesses. We don't simply see reality. Okay, we infer reality based on our past experiences and knowledge. Okay, obviously, if you have already had knowledge of that, this is red color, this is shiny, this looks like a thing that I've eaten previously, then you will be able to recognize that okay, this is an apple. Just like we've discussed that if our phone vibrates, we make an educated guess that we might have received a message based on our prior experiences. Because previously, when your phone vibrated, it was that you had received a message. Okay, so it's an educated guess. We have received education through our knowledge, through our experience that this happens because of this, and then we are making a guess. Then we come to the Gestalt psychologists, Wertheimer, Kafka, and Kohler. When you look at a face, okay, so what they try to explain is that when you look at a face or look at yourself in the mirror, do you usually see your nose, eyes, and lips separately? No, we see it as a whole. We see our whole face. Yes, obviously, if you get a pimple here, then you might go on to noticing if that is the um, part which is impacted. But generally, we look at the whole face. And exactly that is what the famous Gestalt principle also states, that whole is greater than the sum of its parts. Okay. I'm not going into much detail. Okay. This will be covered in much more depth later in the course. Then we have Gibson. James Gibson, a very important person here. Later, Gibson also argued that perception cannot be, um, can often be direct. Okay, the environment itself provides a lot of useful information to us. When organisms or people like us, or even children, for example, we will learn about this more in the developmental part. That when children explore the surroundings, they detect information which is necessary for adaptation and survival. This active interaction with the real world rather than perception solely um, is how sensory input is understood. Okay, and this is what he called the ecological approach. Very important, ecological approach was given by Gibson. So, um, so what we notice here, something important is that perception. Okay, when we look at this image here, something that is very important we have to understand is that perception depends on attention, interpretation, and the meaning making process. Okay. If any of these parts or processes get distorted, unusual experience can occur. Okay, unusual experiences, which is the major focus of this entire presentation, which will be coming to. So whether it's the attention part or the interpretation or how we are responding based on how we have made meaning of that particular sensation. If any of these is missing or is distorted or is deceived, it can lead to what we are coming to disorders of perception. So, what happens when we perceive something incorrectly? What happens when we perceive something that isn't there? That's where disorders of perception begin. Imagine you're studying late at night and you see a shadow in the corner of your room. So there can be two situations. Situation A, the shadow is actually a chair, but you mistake it for a person. Situation B, there is absolutely nothing there, but you clearly see a person. Are these two experiences the same? No. Excellent. Excellent. That is what I'm coming to. And the difference forms the basis of almost all perceptual disorders that we are going to be discussing. Perception normally helps us understand reality. Okay. But sometimes the process of recognizing, processing, or interpreting sensory information becomes abnormal. When this happens, we call it disorders of perception, like we just discussed in the previous slide. So, to put it simply, the senses may be functioning normally. So, your eyes, your ears, everything is functioning normally, but the experience of reality becomes altered. Okay. For entrances, what you can remember are the two distinctions. Focus on this here. Okay. So, the two distinctions here are sensory distortions and sensory deceptions. So, sensory distortions are where there is a stimulus present. Okay, so an object or any entity is present in the environment, but it is perceived inaccurately. Okay, and it can be perceived inaccurately in terms of its intensity, its size, shape, and quality. We'll come to that. Okay, and sensory deception here, perceptions occur with or without. There's a small mistake here. It can occur with or without the presence of a stimulus. What we have to focus here is on the word that false sensory experiences are being created. Okay. And here we are focusing on the perceived inaccurately. Okay. So we are perceiving something, but it is inaccurate because the intensity, size, shape, quality of it has changed. In deception, we are falsely perceiving them. हम उसको perceive ही गलत कर रहे हैं. ठीक है? That is what the difference is between the two. So, in which category would you place a real stimulus that gets interpreted wrongly? So, if there is a real stimulus, but it's being interpreted wrongly, then will it be sensory distortion or sensory deception? Great, lovely. Okay. And if there is no stimulus at all, or if there is the stimulus but you are not able to perceive it correctly, perfect. Then it is sensory deception. So we are going to think of perception like photography. Okay, you know what photography is. Um, we all are people of Chimsy era, so photography is something we all do. The object in front of the camera, um, so the object is in the front of the camera, but the image becomes blurred and stretched. Okay, so if the image is not very clear, it becomes blurred and stretched. Then will it be sensory distortion or sensory deception? Correct, because there is a real object present and the um, perception is being altered. Okay, now if the camera creates an image even when nothing is there, then it would be deception, right? So no object is present. Now let's come to the table here. Um, this table. Um, everything here might seem a lot of complex. Okay, so the terms are very complex, something that might be really new to you all also. As I'm aware, there are a lot of bachelor students, master students. Some terms are simply you've never heard of before, or you've heard, you've not understood or experienced them. So here, like we spoke about sensory distortion. Sensory distortion are like if you've noticed on a day when things are not going well, every small noise feels loud. Okay, so for example, have you experienced that you're writing your exam and even the even if the invigilator is walking around, their footsteps are very noisy. Even if people are shuffling their papers, it's very noisy. Every noise which generally does not make a lot of impact on us on the exam day when we are writing our papers, it feels so irritating at times, right? This happens, right? That mostly happens because we are very anxious. Okay, sometimes when we are sad, we are not feeling well, time also seems to change a little bit. Time feels that it's passing very slowly. You want to go home, the school, the college is not getting over, and you feel that time is going even more slower as it should go, which goes very quickly otherwise when you're playing and having fun with everyone. So everything, when you're sad, everything feels, the noise feels very loud, the time passes very slowly, everything looks colorless and sad. So you notice that because of just one experience, how the intensity of the emotion and the quality of the stimulus, the size, the time perception, everything is changed. So that is what is sensory distortion. Now we have illusions. If I mistake a rope for a snake, is there a real stimulus? Is there a real object? Yes. Is the rope perceived inaccurately or falsely? If I mistake a rope for a snake and the real stimulus is present, am I perceiving rope inaccurately or falsely? No, guys, no, no. If I perceive it inaccurately, then it would be that the size of the rope seems very large, um, or mm, that it looks very huge or it looks very tiny. That would be that I have perceived it inaccurately. Okay, something which is inaccurate, not accurate as it should be perceived. When I'm saying falsely, falsely matlab jo uska real meaning tha, it is not perceived like that. Okay, so for example, the rope has to be perceived as a rope, but I'm not perceiving it as a rope, but as a snake. So that's a false. That is वो उल्टा पड़ रहा है. Okay, so that is how we are saying falsely. Okay, this will take a little time to understand, so don't worry, do not panic. Okay, um, so whenever there is a real stimulus and there is a wrong interpretation of it, that is when deception happens, sensory deception happens, and that is illusion. Okay, there is a real stimulus, there is raw, and we are interpreting it incorrectly or wrongly, then we are getting deceived by it. Sorry. Okay. Now we have hallucinations. What if there is no rope, no snake, nothing at all, but the person still sees a snake and no one else is able to see that snake? Then we call it hallucination. So there is no external stimulus, okay, and there is a vivid perception. Okay, so let me write it here for you. There is a real stimulus here, plus we are wrongly interpreting it. And here we have an external stimulus, plus there is vivid imagination to it or perception to it. That is what we call hallucination. Again, here, similarly, we are being deceived. We are falsely understanding something, falsely seeing a snake which is not actually present. Okay. Then we have another category. These are pseudo hallucinations. Okay. So, what if a person says a voice, that they can hear a voice, but says that I know that the voice is not here. Okay, so this becomes pseudo hallucinations. Okay, to make it simple, I will use Hindi here and explain कि अगर कोई चीज वहां पे नहीं मौजूद है, ठीक है, और उसी पर्सन को दिख रही है, किसी और को नहीं दिख रही है, तो दैट इज हैलुसिनेशन. ओके, अगर वो चीज वहां पे नहीं मौजूद है, ठीक है, उसी पर्सन को दिख रही है और किसी और को नहीं दिख रही, बट उस पर्सन को पता है कि वो रियल नहीं है, इंसाइट है, मतलब यहाँ पे they have basic awareness that this is not real, but this is still something I'm hearing, this is something still I'm seeing, then this becomes pseudo hallucination. In hallucination there is no insight, in pseudo hallucination there is a little insight. Okay, in hallucinations they believe to they have believed that whatever they are seeing or understanding is to be real. Yes, self-aware hallucinations can be pseudo hallucinations. Okay, but pseudo hallucinations are something which they have recognized as unreal. And okay, now we have these categories. As this is our first and demo class, we won't be going diving deeper into these. These will be something which we will cover in our extended course. Okay, right now we are only going to focus on illusions and hallucinations and sensory distortions. Okay. Now coming to sensory distortions. Now we've discussed what sensory distortions are. Can someone explain it, maybe in a few keywords, so that we know that we are on the same page? Or if you have any doubts, we can take it. Just a couple of. Very good. That's very good. Okay. Yes, there is a real stimulus, plus it is inaccurate perception. Perfect, perfect. So what we remember about sensory dysfunction now is that a stimulus is present, but it is perceived differently in a distorted or altered way. So, perfect. Perfect, guys. We are on the same page. Okay. So something real exists in the environment, but the person experiences it in an altered way is what we have understood as sensory distortion. If I am speaking on a normal volume, but someone experiences my voice as unbearably loud, am I speaking loudly? Am I still speaking loudly? No. Yes. So, but does my voice exist? Yes, exactly. That's sensory distortion. So we have a real stimulus, which is my voice. It stays same, it's not changing, but someone else is perceiving it as unbearably loud. So here, the perception of my voice is being altered for that person. Okay, so that is sensory distortion. I hope that with this example, it gets a little more clearer. Okay. Okay, so think of sensory distortion as a reality. Okay. I'll explain it again. Okay. So if I am speaking on a normal volume, okay, but a person is experiencing it as unbearably loud. Like my voice is very loud, like my volume has been increased. Okay. So a real stimulus, which is my voice, does exist. It does not vanishes. वो वहीं पर है. But what is changing is the experience, the perception, or the meaning, or the understanding that the person is having of my voice, how they're interpreting my voice to be loud. So, like we discussed, sensory distortion is when we have a real stimulus plus the experiences being altered. Is it clear now? Okay. So, my voice is there in reality, but the experience of it for that person might be altered. That is sensory distortion. Okay. Now, perception can be distorted in different ways. Like we discussed, intensity, quality, spatial form, and um, time perception. So, if you have severe headache or migraine, and sounds feel very painfully loud, that is when the intensity of that stimulus is changing. Okay. Intensity मतलब how much पे बात कर रहे हैं हम? How much is things changing? Is it becoming louder? Is it becoming soft? Is it becoming brighter or dimmer? So that is what intensity is about. Louder हो रहा है, soft हो रहा है, bright हो रहा है, dim हो रहा है, कैसा हो रहा है? For that person, that is when intensity is being altered. So sound itself hasn't changed. Your experience of the sound has changed. Okay. Now, if the sound is increasing for the person, we use terms like hyperacusis. And when it is decreasing for the person, it is called hypoacusis. This is something which is much more deep and much more fun to learn also, but we are not going into that depth for today's class. We have to understand the basic foundation before going into that detail. Okay. But simply putting it, if a voice heard by the other person, perceived by the other person, uski intensity is increasing, we use hyperacusis. If the intensity is decreasing, it is hyperacusis. So if I'm speaking right now and you automatically, achanak se you feel, because you're having a headache, you feel that ma'am's voice is so irritating, she's speaking so loudly, then your intensity is increasing for it. But if you are having a very fun day, you are daydreaming, and I'm speaking something you cannot hear, you'll say, her voice is not even loud enough to cross the brain barriers so that I'll be able to listen to it. Okay, so the intensity is changing here. Yes, you may ask the doubt.
Uh, Hello, ma'am. Can you hear me?
Yes.
So actually, I wanted to ask. I had a patient who had OCD, and he had sort of sensory. He had this thing where he would look at something, and he was confused if he looked at a rope or if it was a snake or how long was the rope or if was the rope green, and he had it with different objects. Like if he saw the tree, was it a tree? Was it not a tree? So
Mhm.
would this be sensory distortion, and would can this tie into something like OCD, where the person would want to look at it again and again, or he would have these mental compulsions where he would think over and over whether this was it or it was not.
Okay, so although I do not know a lot of depth of it, but from what we are discussing right now, yes, this can be a sensory distortion, and it can point towards the intensity of it being different and also the quality, something that I'm just coming to. Okay, but we can
Thank
connect
you.
over this and discuss this in more detail sometime. Okay,
Sure. Thank you.
welcome. Okay, then we have the change in quality here. Imagine that you're having your usual coffee, but suddenly it tastes metallic. Okay, so here the coffee has not changed, but your experience of having coffee has changed. Here, the nature and quality of the stimulus is being altered. So the quality is like, what is it like? So the taste is changing, the color is changing, the texture, the tone of it is changing. Okay, so like just discussed right now, if they are seeing the tree, but the tree's color is not like it is supposed to be, then um, probably the quality of it is changing. The stimulus ka quality or the nature of it is being changed. Okay, then we have spatial form. If you've watched the movie Alice in Wonderland, Alice suddenly becomes very small or very large, and psychology has names for this. This is called this when we have micro. Uh, when the person becomes very small, then objects appear to be smaller than they really are. Okay, and then there's macro, where the things become very large. So if you see this bottle here and suddenly it feels very huge, then we will call it um, towards the macro side. We'll see it in more detail later on as well. Okay. Now, time perception. This is one of my most favorite here. If you notice that 10-minute lecture before lunch feels like 1 hour, and just a 2 hour movie with your favorite actor and friends feels like 20 minutes, what changed? The clock or your perception? So, in some conditions, time seems to be faster, slower, longer, or shorter than it actually is when our perception towards the time is changing. When we are sad, the time might feel slow. When we are with friends, with family, the time might be fast. So that is how the time is being distorted. Although the time remains same. उसके तो equal intervals ही हैं. Okay. So this is about sensory distortion. There are a lot of terms here, lot of conditions, lot of things that we can discuss. There are a lot of what we can call disorder specific to these or condition specific to these, which we can explore further in our classes. Now, up to now, we have seen situations where reality exists but gets distorted. Okay, but what happens when reality exists and we completely misinterpret it? That takes us to the most important topic in psychopathology, which is illusions. Yes, sensory deceptions, and the part of it is illusions as well. Okay. So on our previous slides, we've discussed sensory distortions. Now we are moving to sensory deception. Here, the perception moves further from reality. We are moving further away from reality. The person experiences something that does not accurately correspond to what is actually present. False मतलब जो नहीं होना चाहिए वो दिख रहा है. ठीक है? So that is false. Okay. Like we discussed the two scenarios earlier, in which you see a rope but mistake it for a snake. Okay. And there is another situation where you see a snake when there is absolutely nothing there. One has a stimulus while other does not. ठीक है, एक में आपको रोप दिखाई दे रही है सांप की तरह. ठीक है, एक में वहां पे कुछ नहीं है बट सांप दिखाई दे रहा है. ठीक है, so those are two different conditions and that is what we are understanding here. Both experiences are deceptive in nature, They both might or might not have a stimulus but are falsely interpreted, but they occur in different ways. And that's why sensory deceptions are broadly divided into illusions and hallucinations. In, in illusions, a real stimulus exists but is interpreted incorrectly. Okay, like we saw in the initial tables. Okay, so we have, again, I'll write it here, real stimulus, but we are wrongly interpreting it. Anyone remembers what was it for hallucinations? It's okay. So there is no stimulus here. And we are, yes, we are making a vivid perception. Okay. So in illusions, a real stimulus exists but is interpreted incorrectly. In hallucinations, a perception occurs without external stimulus. Okay. The difference between illusion and sensory distortion is in sensory distortion, there is a stimulus. The stimulus is not changing, but the experience of that perception is changing. Experience in terms of the intensity of it, the quality of it, the time, the spatial form is changing. In illusions, we have we have a stimulus but we are wrongly perceiving it. मतलब उसको जिस तरीके से परसीव करना था वैसे ही नहीं कर रहे. ठीक है. अब जैसे आवाज है, आवाज लाउड सुनाई दे रही है या कम लाउड सुनाई दे रही है. It's not loud enough, so it's still the voice. Here we have a stimulus. Snake is sorry, the rope is there but it is falsely perceived as snake. इसमें स्नेक या रोप जो है वो बड़ी छोटी नहीं हो रही है. The stimulus ही उल्टा हो गया, change ही हो गया. The stimulus is there but not the stimulus that was actually supposed to be perceived. Is it understood now? Yeah, thank you. Okay, so you'll notice that illusions and hallucinations each have several forms, but don't worry about these yet. Like we have complete effect, paradolical, and these. So we'll discuss about these with examples. For now, what we have to understand is that illusions are misinterpretation of the real stimulus, and hallucination is perception without stimulus. Okay, it will become easier if you remember the examples that I'm quoting. Then sensory distortion, illusion, hallucination, इनका differentiation करना will be more easier for you. Okay, now interesting question. Have you ever looked at clouds and seen animals in it? इस cloud का shape घोड़े जैसा दिख रहा है, इसका हाथी जैसा दिख रहा है. Or have you looked at a shadow and mistaken it for a person after watching a very horror movie? Those everyday experiences help us understand our first primary sensory deception, which is illusions. Okay. Okay. Now, as we see this picture, what do you notice about this picture? It looks like moving. The floors look very distorted. The walls look very distorted. It is confusing to look at, right? But is the image actually moving? Is the image actually moving? No. No. Yes. Yet many of us experience a sense of movement. This is why perception is very interesting and fascinating. Our brain doesn't simply record reality, it actively interprets it. Okay. On our previous slide, we learned that illusions occur when stimulus is present, but is interpreted incorrectly. Here, the stimulus is real. Interpretation may become misleading. ठीक है. Deception मतलब झूठ. झूठ लग रहा है, आपने बोला कि वहां पे रोप है बट आप झूठ बोल रहे हो कि नहीं वहां पे स्नेक है, ठीक है. सो यू आर बीइंग डिसीव्ड, द इंटरप्रिटेशन इज मिसलीडिंग यू. ओके. So one of the most important ideas about illusion is that perception is never based on only on sensory information. When you enter a dark room, what else influences your perception inside your eyes? जब आप एक अंधेरे कमरे में एंटर करोगे तो क्या क्या चीजें आपके दिमाग में आ सकती हैं which might influence your perception? What do you think? Yes, light, the lighting, the thoughts, past experiences. Yes, absolutely. Something that I wanted to hear. Okay. So our expectations of what can be in that dark room, our fears, our past experiences will shape it. Okay. So if you've seen those, if you've been or seen those escape rooms or horror rooms, so when you enter into that dark space, you have expectation कि यहाँ से भूत निकलना चाहिए. ठीक है. That is what makes you more fearful of it, right? Or if you've been already to it, you have a past experience that okay, now this if I'm standing at this place, the platform might drop all of the sudden in this escape room and it might get a little scary. So that is a past experience which shapes your perception of that dark room. So perception is sensory input, whatever we are taking in from our senses, plus the meaning our brain is attaching to it. So similarly, if you're walking alone at midnight, a shadow suddenly appears. If you're already anxious, what are you more likely to perceive? That there's a person or there is a threat? Mostly, you'll perceive that there is a threat. The shadow is real. The interpretation is influenced by expectation and emotion. If you're in a jolly mood, probably you can also perceive that there's a person behind you. Okay. So if now very important, this is very important. So if someone occasionally mistakes a shadow for a person, should we immediately diagnose a mental disorder? Wonderful. We will not always, we won't diagnose it as a mental disorder. Illusions are not equal to psychopathology. Okay? Illusions by themselves are not necessarily indicative of psychopathology. Many students assume that every abnormal perceptual experience indicates a mental illness. Yes. So that is not true. Have you ever thought that someone called your name in a crowded place? या घर पे एक कमरे में बैठे हो तो कभी ऐसा लगता है कि मम्मी दूसरे कमरे से बुला रही है, पापा बुला रहे? Yes. So this is an everyday illusion. Okay. So we cannot give it a name of a disorder. So no disorder is required here. Under what conditions do you think a perception becomes less accurate? If you are very tired, if you're very stressed, if you have anxiety, if you're walking in a dark alley, then your perception can become distorted. ठीक है, आपका less accurate हो सकता है आपका perception. So illusions become more like illusions become more likely when perception has incomplete information or when emotions strongly influence interpretation. Okay? So now here we have two terms, illusion and intellectual misunderstanding. Okay? So illusions is, to simply put it here, as it was also mentioned here, error of perception. And intellectual misunderstanding is error due to lack of knowledge or judgment. Okay? So if a shadow is mistaken for a person, it is a perceptual error. ठीक है, हमसे एक गलती हो गई कि हमने शैडो को पर्सन समझ लिया. ठीक है. But if a person goes to a shop, they buy a fake diamond, believing that it is a real one, that is because of lack of expertise, then it is because of knowledge error, intellectual misunderstanding है, knowledge या reasoning इसमें involved है. ठीक है. So illusion is when you have an error of perception, intellectual misunderstanding when there is an error of judgment because you do not have the right amount of knowledge to understand it. Okay? Illusion is I saw something wrongly. Intellectual misunderstanding is I concluded something wrongly because of lack of understanding. So a mini recap, a mini focused understanding of what we've covered till now, that illusions have real stimulus present. Can healthy people can experience illusions? Yes, healthy people can experience illusions. Are emotions and expectations involved? Yes, definitely there are involved. Perceptual errors or judgment errors? Illusions are perceptual errors. Okay. Now suppose a fan is running in the room. Okay. There are two scenarios. There is scenario A. A person hears a fan's noise and mistakes it for the people whispering. ठीक है, फैन है पर उसको जो है परसीव किया गया है mistakenly as people whispering. And there is scenario B, or the second scenario, a person hears a fan noise clearly as a fan, but at the same time also hears voices talking. Either पंखे की आवाज भी आ रही है, fans noise is also there, and also the voices they are hearing. Both are happening together simultaneously. So are these experiences the same? No. And that's exactly the distinction we are learning here in this slide. Okay? Illusion is, in illusion, the real stimulus gets transformed. अब ऐसे याद रखो, real stimulus gets transformed. ठीक है? Into something else. Okay? So real stimulus, no, it is not known as functional hallucination. It is a different thing. Illusion is a different thing and functional hallucination is a different thing. Okay, coming to that, I'll tell you. Okay. Illusion is when a real stimulus is being transformed. The fan's noise is being transformed to whispering. And what do I say? The sound of rustling leaves will appear as whispers, or rope becomes a snake. Okay? So those are all examples of illusions. What happened to the original stimulus? It is being misinterpreted. So real stimulus changed into something else. Functional hallucinations is now, look very carefully here. The fan's noise remains there, but person also hears an extra something. Okay? So that is functional hallucination. So illusions is when something is replacing something, and functional hallucination is when something is being added to it. Okay? Yes.
Ma'am, what does the word functional here donate?
Just a bit. Okay, so there are two things which are functioning here together. The function of both the things are intact, but still it is impacting the person. Okay, so here we can look at occurs alongside the real stimulus, a real stimulus in the same modality. Both the things are functioning, but in the same modality as well, but they are still different and perceived together. Okay. Now we have what we call the trailing phenomenon. If I wave my hand once, how many hands should you normally see? One. Okay. The functions of both the part remain intact. Okay. So you can hear the fan's noise as well as you can hear the voices, but again, they are overlapping each other and leading to a misinterpretation. That is why functional hallucination. Okay, we will come to more depth of it later on. Okay, yes. If I wave my hand, you see one hand. But sometimes what happens is when I wave my hand continuously, you might see multiple copies, like we can see in this picture here. So this is what we call visual training. Normally, when an object moves, our brain continuously updates its position. But in visual training, the moving object appears to leave behind a series of copies. Like you can see, there are a lot of copies of the hand here. It's almost as if the brain doesn't completely erase the previous picture or the position. Okay, so this is another concept of illusions. Notice that in this phenomena, it often is often discussed alongside perceptual disorders, but technically it is not classified as classical illusions. Okay, so this is a phenomena which can be asked. This is not a classic illusion, but something that we wanted to bring to your notice here. Okay, so visual training can be understood as motion plus ghost copies of it. Okay, so these are like ghost copies, after images and ghost copies. Okay, so moving objects leave a visual footprint is what visual training is about. Now, coming to the types of illusions, we can understand this through the mnemonic. Let me write it a little bigger. Okay. Now we have this mnemonic. You can remember. You can remember it with covers all perceptual illusions fantastically. Okay, so covers all perceptual illusions fantastically, and this denotes each of your illusions as well: completion illusion, affect illusion, paradoxical, and fantastic illusion. Okay, now what is completion illusion? So, for example, if I write here, how will you fill this up and what will you tell this? What is the word that I've written here? Psychology. So did I write the full word? No, the brain completed the missing information. So completion is simply as fill in the blank, fill in the gap. The stimulus is incomplete. The brain supplies the missing part. Okay, so completion ko you can simply remember with the memory tip that completion is complete the missing pieces. Okay, so these missing pieces, essay questions may it can come as yes, this gestalt, closure principle, complete figure, missing letters, all of this. If any of these is coming, then it is completion illusion. Then we have affect illusion. Affect illusion is if you're walking alone at night, again coming to the same example, and you're feeling scared, and are you more likely to mistake a shadow as a person? Yes, you are. Why? Because emotions influence your perception. So, whenever emotions such as fear, anxiety, grief are shaping your perception, it is what we call as affect illusion. So, affect is emotion, affects perception. Okay. Then we have paradoxical illusion. This is one of the favorites. Like we discussed earlier, that if you see a cloud which is shaped as an animal, okay, or if you see fire and it is taking shapes of different objects, then it is called paradoxical illusion. The stimulus is vague and meaningless. The brain converts it into something meaningful. Okay, so जैसे seeing a face on a moon, okay, or animals in clouds, or religious figures on walls, okay, or shapes in random patterns. So all of these are, yes, very good example, projective test. So we can break this word down into pattern and idea. So finding patterns where none exist is what we call paradoxical illusion. Then we have fantastic illusions. This is the rarest and most dramatic form of illusion. बहुत rarely देखा जाता है. The real stimulus becomes transformed into something bizarre, imaginary, or fantasy-like. Imagine looking into a mirror or briefly feeling your face looks like an animal. Okay, so there is a there is a book or a case that a psychologist has also written where the patient who would come would see them as faced with see their therapist having a face of a rabbit. Okay, so here the illusion is when the face is, for example, here the face is being replaced by a fantasy object, something that they have seen in movies, books, or something which is imagery. Okay, so fantastic in terms of fantasy, fiction like. Okay, so these are the types of illusions. Now suppose you are sitting in your room alone and suddenly hear your name calling. You check outside, you check your phone, you check your room, but nobody is there. If there is no actual sound source, what category of perceptual experience are we moving towards? Hallucination. Yes, auditory hallucination is one part of it, but hallucination is the bigger part, picture. Let's compare this it with illusions. Illusions is where a stimulus is present but is misinterpreted, and in hallucination, the stimulus is already not present. ठीक है, अगर कहीं पे भी stimulus absent लिखा है, directly it is hallucination. Okay, many psychologists have defined hallucination in different ways, but for entrance exams, all definitions boil down to the central idea that hallucination is when perception is happening without an object. This is Esquirel's famous definition, the most of one of the most quoted in psychopathology as well. Okay, so a few things which you have to remember with hallucination, a checklist is that there is no external stimulus. It is experienced as a real perception. Okay, that is where we differentiate hallucinations and pseudo hallucinations. Okay, this is not something like daydreaming, it is vivid. There is vividness of a real perception. Okay, third, you believe that it is real. Okay, if I imagine an elephant right now, do I believe it is standing in the classroom? No, it's an imagination. But in hallucination, I will accept that it is really present there in front of us. Okay, and fourth, no under there is no voluntary control over this. Okay, so a person cannot simply decide to stop it. So there is no voluntary control. It is real for the individual. The perception is very true and vivid, and there is absence of external stimulus. Okay, so there is mnemonic for this to remember as well, which we call as hall, a simple one which I've picked up. Okay, this is heard or seen as real. There is absent stimulus, and there is lived experience of it, real experience of it, and you have no or lack of voluntary control over it. I think hallucinations is something that we are mostly familiar with because we've read so much about it. You don't need to memorize these long definitions, okay? So if you know these 4 features of hallucinations, it's more than enough. Now, what's the difference between an imagination and hallucination? Imagination is something that you can voluntarily control. Okay, so if I'm daydreaming right now, I'm thinking about going to a beach, there are waves and everything. I can voluntarily stop myself and come back to the present. Okay, but in hallucinations, you cannot stop it and it is involuntary. So that is the difference. Okay. Now, as you have also mentioned about auditory hallucinations, hallucinations happen in different sense organs of our body. Okay, the first one being auditory hallucinations. Do you know why have I put auditory hallucinations first here? Okay, I've put yes, perfect. It is the most common. Although it is when we see movies and when we read about things, visual hallucination is one which is more popularly understood, but the most common one is auditory hallucinations. Wernicke's referred to auditory hallucinatory voices as phonemes. Okay. And okay. So now whenever we think about sounds in general, we have a simple sound. Then we have a meaningful sound or voice, and then we have special type of voices. When we speak about simple sound, सबसे simple sound क्या होगा? कोई भी आवाज बची ना अचानक से, like buzzing, hissing, uh, ringing of bells, whispering, humming sounds. All of these are very simple sounds. If I'm knocking on the door, it's a very simple sound. Okay? So these are all what we call elementary hallucinations. Okay? These are what we call elementary hallucinations. आप इसको ऐसे भी याद रख सकते हो, like elementary school में we go, very basic things are learned, no conversation, no messages, no meaning. So those are the most simplest thing a person can hear, a sound. That those are elementary auditory hallucination. Okay, so if a person says that I hear a humming voice, then it is a elementary auditory hallucination. Then we move on to complex auditory hallucinations. Jab sounds become more complex. When does sound become more complex? When there is a speech, where there's voice, there's music, there is meaningful understanding sound. Okay, so those all become complex. Okay, so if you're hearing a voice discussing persecution of control, so that would become complex auditory hallucination. Complex in the sense that it has some content in it. The voice is saying something. The music has structure. There is meaning attached to it. Okay. So ringing bells is which type of hallucination? Elementary. And if you hear voices saying that someone is watching you, then that would be complex. From here onwards, we have three specific conditions, and these are very interesting. First, there is running commentary or second person hallucination. Okay, so if imagine that there is a voice that you're hearing in your ear that now he is sitting, now he is writing, now he is looking at the screen. Okay, so there is a running commentary like in the cricket. You see that there's a commentary going on. So that is called second person running commentary hallucination. Okay. Then there are third person hallucinations. What if the voices stop talking to you and start talking about you? Okay. So he is lazy, she is very noisy, he never studies. So there are two voices speaking to each other, or it can be just one word, one voice also, but they are using third person in terms of he, she, they. Okay. So they're talking to the patient. Okay, so now if I say that now you are reading the book, okay, so that is a running commentary. But if I say he is opening the book, that would be third person hallucination. Okay, then we have the last one, which is the imperative command hallucination. So if commands are given, this is seen the most clinically. So if a voice says leave the house, don't trust them, hurt yourself. Okay, so these are commands given to you to do certain things. So those are called imperative or command hallucinations. Fun, right? This is very interesting. And when you see these in your clinical setup, it is even more interesting. I have the opportunity to do it. I hope that you guys also do get the opportunity. Now, when we say a patient hears a voice, do you think all voices sound the same? No. Okay. Auditory hallucinations can differ tremendously in the type of content, the clarity, the emotional tone, and the perceived source. Okay. So if you can recognize, can we recognize every voice that we hear on the call? No. So similarly, hallucinated voices may be clear sometimes, identifiable at certain times, but that sometimes it might be vague. Like when we take up a call, sometimes the voice is clear, sometimes it is not. Sometimes it is easy to understand, sometimes it is not because of the network connection. Similarly, hallucinated voices भी वैसे ही काम करते हैं, कभी कभी clear होंगे, कभी कभी vague होंगे. Sometimes the content of it also differs. For example, sometimes it can be abusive, threatening, neutral, friendly. helpful or friendly, and sometimes it can be even more different, something else itself. Okay. Then sometimes the content can be meaningful and easily comprehensible, sometimes it cannot be. Okay. But although I've written here that it can be abusive and frightening and threatening at times, but not always. Okay. Okay, now where do patients think these voices come from? If someone hears a voice, how might they explain it? Okay. Patients often try to explain it in the unusual experiences and attribute them to witchcraft, telepathy, radio transmission, television signals, or external forces. Others may believe that the voices are even coming out of the body. Okay. So, what is happening? First, the hallucinatory voice is coming, and then an explanation is being attached to it. This is very important in when we are understanding psychopathology. Now, there are three important phenomena. Okay, let's look at these. These are very fascinating. There is talkie tongue. What do you think this phenomena might involve? Any guesses without reading it? So in talkie tongue, what happens is the patient feels speech is being produced through their tongue or throat without their control. Okay, टंग या थ्रोट से आवाज आ रही है पर उनका उनके ऊपर कोई कंट्रोल नहीं है. देयर इज नो वॉलंटरी कंट्रोल ओवर इट. So that is called talkie tongue. Tongue seems to be talking by itself. Okay. Then there is misattribution of voices. What if a person is hearing has hallucinated voices but believes that they are actually coming by from nearby people? Okay. This is a misattribution. They are misattributing the hallucinatory voices to a source which is not the right source. So a wrong source is being assigned to the voice. Then comes delusional elaboration. This is very interesting. What does the brain naturally try to do when something unusual happens? कुछ अजीब सा हो रहा है हमारे साथ, हमारा दिमाग क्या करेगा? एक्सप्लेन करेगा उसको, रैशनलाइज करने की कोशिश करेगा. The patient also develops a delusional explanation for the voice. So, if they are hearing voices, for example, they may believe that my neighbors are secretly transmitting messages to me. So, hallucination. So, hallucination is an experience of the voice, and delusion is the explanation that we give to it. Okay? So, a voice is being heard, but उसको elaborate करके delusionally कैसे explain किया जा रहा है कि मेरे neighbors मेरे बारे में कुछ बुरी बात कर रहे हैं या they are transmitting a message to me. Okay, so that is delusional elaboration. How we are elaborating on the content of the hallucinatory voices. Okay. Now that we've discussed auditory hallucinations, we also have what we call visual hallucinations. Mostly the movies and the films are based on these, where people see other people around them, ghosts, or see things that aren't there. These are called visual hallucinations, seeing something which is not actually present. This is visual hallucinations, okay? It is mostly connected with schizophrenia, but in actual, it happens more in organic brain conditions of delirium. Okay. So if there is auditory hallucination, yes, the first probable diagnosis goes towards psychosis of schizophrenia. But when there is visual hallucination, it goes more towards organicity or organic brain conditions. This is a more oversimplified way or to memorize things. Okay. But later on, when you come to such experiences, you'll be able to understand better. Like we understood auditory hallucinations as elementary, complex, and the rest of the three, here similarly we have elementary, complex, and scenic. Okay. As visual hallucinations become more complex, they move from flashes of light to entire scenes. So, elementary visual, सबसे simplest form of something that you can see is light, color, or a spark. Exactly right. So when you're seeing, when a person with visual hallucination sees flashes of light, sparks, or colored lights, where there is no meaning of the object, no person, no scene, then it is what we call elementary visual hallucination. However, if that light, that feature of the visual thing that you're seeing, the object that you're seeing becomes more complex in its nature, that you're seeing a person, you're seeing an animal, you're seeing an object which is well formed, then it becomes a complex visual hallucination. So, for example, a person sees someone standing in the room when nobody is there. Okay? So, that is a complex visual hallucination because a complete figure can be seen. Okay. Then we have scenic hallucinations. These are also very interesting and easily memorable. Okay. What is more complex than a person? A whole event, right? If you can see a whole event. So a person who doesn't see an object, but they may see an entire ceremony being performed in front of them, a battle, a crowd, a fire scene, something just like they are watching a movie in front of them, but in reality nothing is in front of them. That is what we call scenic hallucinations. Okay, so scenic, where a scene can be seen. Okay. A lot of scenes. This is where students may get confused because we have already taught about we've already spoken about sensory distortions, but sensory distortions can also be a form of sensory deceptions. Okay, वो ओवरलैप करते हैं, उनको डिफरेंशिएट करने के लिए, डिस्टिंग्विश करने के लिए दो चीजें बनाएंगे. Perfect, very nice example. Even I watch a lot of movies. It's nice to hear that. Yes, Bajirao Mastani mein Ranveer Singh in the last portion of the movie, he sees a battle scene in front of him and he runs towards the ocean. So that is a very good example of scenic hallucination. Yes. Then, like we discussed earlier, if an object is seen gigantically or larger than its real size, then we call it macropsia. And if it's seen smaller than its real size, we call it micropsia. Okay. Now, there are also certain special types of hallucinations. Okay. Um, One of it is called the Charles Bonnet syndrome. Here, the person cannot um, does not has a clear consciousness without any psychiatric illness. They are still having a visual hallucination. मतलब यहाँ पे हम उनको कोई diagnosis नहीं दे सकते, but still they are having a psychiatric illness. Okay. Now, something very interesting is that a few of us have read the Gulliver Travels when we were small, right? Gulliver visits this land where there are tiny people. These are Lilliputians, which I remember. Okay, so from this comes the Lilliputian hallucination when little people can be seen or miniature models of a figure can be seen. Okay, so that is Lilliputian hallucination. But for those little figures, Gulliver was the one which was very tall and large figure. So Gulliverian hallucination is the right opposite of it when people see giant objects, which is not the thing that they have actually perceived. Okay, now you can think about macropsia and micropsia. They are similar here. उनके लिए alternative terms हैं, ऐसा कुछ बहुत different नहीं है. ठीक है? Sometimes this also happens that not just one sensory modality is involved in hallucinations. Okay, so probably you see a person in front of you and you can hear them also. So though two sensory modalities are being occupied here, the visual as well as the auditory. So there are two hallucinations occurring together simultaneously. So that can also occur. This occurs specifically in cases of temporal lobe. Yes, I'm coming to that. Temporal lobe epilepsy and chronic and late onset of schizophrenia. Okay. Okay, Charles Bonnet syndrome does not actually have an example per se, but to explain it more easily is that a person is having visual hallucinations. There is clear consciousness. but no psychotic other symptoms. Okay, so that is Charles Bonnet syndrome. So if a person is experiencing visual hallucinations without schizophrenia, then that becomes Charles Bonnet syndrome. Okay. Um, we'll come to this later on in the MCQ part, then you'll be able to understand this better. Yes. So mostly the brain regions which are involved in this visual hallucination are all visual cortex and occipital lobes, which are primarily involved in visual processing. Okay, so if someone sees things, which lobes comes to our mind is the occipital lobe. So any brain region which is related to the occipital lobe is related to this. Now we come to olfactory. Olfactory is similarly as discussed earlier of visual and auditory, where we can smell something which is not actually present. So if you enter a room and you feel that you can smell something is burning, but nobody else is noticing it, but you can smell it, then that is what we call as olfactory hallucination. Now, this word here is another word for olfactory hallucination, phantosmia. ठीक है, फैंटम स्मेल से आपको इसको याद रखना है, फैंटम स्मेल से. ठीक है, so phantom is something which is ghost or ghostly or not actually present. So a phantom smell, phantosmia is what we call for olfactory hallucination as well. A smell is experienced even though no odor or source of it exists. ठीक है. So if you smell smoke and everyone else smells it too, then it is not olfactory hallucination. But if you smell it but others cannot, then it is olfactory hallucination. Okay. Now this smell can be pleasant or unpleasant. Mostly it is unpleasant. Okay. Burning की smell हो सकती है, rotten food, foul odors, or decaying smell. Okay. Often something which smells bad. Now this is linked to our again temporal lobe. Okay, temporal lobe epilepsy में के cases में बहुत बार जो olfactory hallucinations देखे जाते हैं. तो again not schizophrenia but a brain condition, organic brain condition, which is leading to olfactory hallucinations. Now in olfactory hallucinations we have olfactory reference syndrome. So if you imagine a person believes they smell terribly, okay, बट देर इज नो एक्चुअल ऑर्डर. ठीक है, उनको लग रहा है कि उनसे गंदी स्मेल आ रही है, बट एक्चुअली में कोई गंदी स्मेल नहीं आ रही. वट विल हैपन टू देयर बिहेवियर? दे माइट थिंक दैट अदर पीपल आर अवॉइडिंग देम. They think that people are reacting to their smell. They will also socially withdraw from them. Okay, so the person believes the smell is real and other people can smell it too. Okay, so this is olfactory reference syndrome, or an easy way to remember it is not the official name but order rejection syndrome. दूसरे लोग आपको रिजेक्ट करके भाग रहे क्योंकि आपसे ऑर्डर आ रहा है और वो भी आपने आपको ऐसा लग रहा है. You are referencing it to that. Again, an explanation that you have given to your symptoms. Okay. Now, when olfactory hallucinations and delusions happen together, what will happen? कि आपके hallucination के लिए you have given a false explanation. Okay, so a person smells something unusual and they conclude that someone is poisoning me. ठीक है, कुछ तो poison डाला है इसलिए मेरे को वो smell आ रहा है. ठीक है, so this is what we call olfactory hallucinations with persecutory delusions. Delusions will come later on, then you'll understand the different types of delusions and what is persecutory delusion. Okay, but again here experience जो है olfactory, that is hallucination. Explanation to it is delusion. Now, like I mentioned earlier, smells do not often be unpleasant only. कभी कभी pleasant smells भी आते हैं. ठीक है, so these pleasant smells can be of flowers, okay, perfumes, religious fragrances. ठीक है, so that is called pleasant olfactory hallucinations. Very simple, pleasant smell है तो pleasant है. ठीक है. Now we have gustatory. Gustatory is when taste is involved. You taste something which is not actually present. This is also phantogeusia. Okay, you can remember as phanto, ghostly, and geusia. A G se you will remember gustatory. Okay, so you check, there is no food, no drinks, nothing could explain it, but still the taste is coming. For example, a metallic taste is coming, a bitter taste is coming in your mouth, but you have not eaten anything. There is nothing that you've had, but still that taste is coming. So that is what we call as gustatory hallucination. Okay. So yes. Again, like previously understood, here also the tastes can be are mostly unpleasant, bitter, metallic, rotten, foul. ऐसे गंदे tastes आते हैं person को, ठीक है? This is again related to a neurological condition, which is again epilepsy. Epilepsy or psychotic disorder के cases में ही gustatory hallucination भी देखा जाता है. So if a person says, okay, now there is an important differentiation here, that if a person says that everything tastes bland, nothing tastes nice, okay? So that can also be linked to depression. Okay, so loss of taste, reduced enjoyment of food, everything tastes bland. Okay, now this is not gustatory hallucination. When something is altered in the taste perception, that is when we call it a hallucination. Something which is not supposed to be present, a phantom taste, ठीक है, a ghostly taste, ठीक है, एक अचानक से आया एक different सी चीज जो add हो रही है, that is what we call gustatory hallucination. Bland taste is not necessarily hallucination, not necessarily hallucination. It can be, but not necessarily. Okay. Then we have tactile and haptic hallucinations. Here, as the name suggests, that you feel something which is not actually present. Okay, touch wise. So, if you have your phone, it's in your pocket, it vibrates, and you checked it immediately, but you realize that there is no notification. That's a normal everyday experience. But now imagine that feeling touch over your body or movements of insects or electrical sensations repeatedly when there is no physical stimulus existing. This is what we call as tactile hallucinations. Unlike auditory hallucinations and visual hallucinations, these hallucinations involve bodily sensations. इसमें phantom touch है. ठीक है? So there are 4 types of it. Quickly going through them. Formification. Formication is when it is one of the most disturbing sensations. What will be the most disturbing sensation? When you think that bugs, insects are crawling over you. Yes. Yes, you may please ask.
Yes, ma'am. So I have seen a lot of this in bugs and insects crawling in patients with diabetes. Is that true, or they, usually complain about that पैर में चींटियां चल रही है, झंझनाहट हो रही है. So is it like actually physically present in patients with diabetes, or it's just an hallucination?
No, that is actually present. That is because of the neurological conditions, the nerves becoming weaker with diabetes and many other conditions like that. That is not hallucination. Okay, hallucination is literally when they feel a bug or an insect is crawling over them. An insect is crawling, a small animal is moving over them. Okay, and they are not ready to understand that this is not reality. They will believe most probably that this is really happening. ये जो है हम कोकेन साइकोसिस या अल्कोहल विड्रॉल के केसेस में ज्यादा दिखता है.
Okay.
When you're speaking about diabetes, it is more towards a hormonal change or neurological condition or something organically related.
Okay, ma'am. Noted. Thank you.
Okay. Welcome. Then we have the second type, which is the haptic. Here, a simplest form of touch is being experienced. So someone is touching them, a hand is brushing against them, pressure, there is some pressure on the skin. So that all comes under haptic hallucination. Okay. This here, mostly a person is touching you. ठीक है, यहाँ पे animals पे था, animals or insects पे था, यहाँ पे a person is touching you, is what the person experiences. Then there is kinesthetic hallucination. Now these hallucinations can also overlap. Okay, kinesthetic hallucination is when you feel that some movement is happening over your body. Okay, now movement as in a person experiences body movement even though the body remains still. ठीक है, जैसे they feel that मेरे my arm is being twisted, my leg is being pulled, or my body is moving without actual movement. So that will be kinesthetic movement. Body may there is some movement happening for that individual, but that movement is not actually happening, is what we call kinesthetic hallucination. Then we have somatic or visceral hallucinations. The last one, if a sensation is not on the skin or there is no movement, but something which is happening inside your body, internal organs पे, ठीक है? Like an electricity moving through a body part, ठीक है? Or an organ has shifted its position, और internal bodily changes हो रहे हैं. सोमा जो है यहाँ पे हम body के लिए use करते हैं. तो when we say somatic hallucination, then we are speaking something is happening inside, internally in the body, organs के मतलब में. Extending on to this, we feel that our organs are being torn or ripped away, or there is some twisting or movement in our internal organs, that is still what we call visceral hallucinations. Okay, so this was about all the things that we've covered, but as we have seen in the initial slides, there are a lot of other sensory distortions and deceptions and lot more things in disorders of perception. But limiting to the content of this demo class, we will keep it till here. Now we will be moving to the MCQ questions, and I'm pretty sure that you will be answering it well. I cannot see the full comment. Can you please unmute and tell me what you're chatting here?
So she has mentioned, how do we know if it's hallucination, like feeling sensation inside the body? Moving organs is different, but normal electric sensation.
ये तो अभी we can't tell ना how will we be able to understand it. It is only a person who has hallucination can tell us about it. But electric sensation, a particular organ may they can feel. Okay, and a organ is being moving, like a stomach has rotated its position, or my heart is not here but it is moved to the other side of the body. That is what we call more about what we name it as somatic or visceral hallucinations.
And
Okay.
also when they go for physical test, of course, there's no evidence for that. So that also indicates.
Okay. Hallucinations do not have evidence for the thing really happening to them. Okay.
Also,
Now,
just before we move to the MCU practice, can everybody just rate their understanding of this topic from 1 to 10 before we move on to the MCQ practice?
that's really great, guys. But let's see with the MCQs if we'll be able to answer. Okay. Can we move to the MCQs? Okay, so this is the first question. Please type your answers out in the chat box. Very well. Third person auditory hallucination is when voices typically discuss the patient among themselves. Okay. And when is it that when they are getting commands, what is that called? The first one gives commands to the patient. What is that called? Yeah, imperative. Someone said second person. No, not second person. It is called imperative. Second person is when you have running commentary. Okay. So when you're narrating the patient's action, that last one, D wala, that would be second person. Okay. Now, the next question, which of the following is an example of haptic hallucination? Feeling insects crawling on skin, seeing insects crawling on wall, hearing voices discussing oneself, smelling burning down. Perfect. It is A, definitely. It is a haptic or tactile hallucination. Seeing something will be visual hallucination, hearing will be auditory, and smelling will be olfactory. Okay. Identify the correct statement. Illusions cannot occur in normal people. External stimuli are absent in hallucination. External stimuli are absent in illusion. Hallucinations are common in normal person. Okay. We have to identify the correct statement here. Okay. So if we use the method of elimination, for example, hallucinations are common in normal people. ये तो गलत ही हो गया. Okay, this is not correct. Then illusions cannot occur in normal people. This is also wrong. We've just discussed it that it can occur with us also. If we hear our name from the other room, it can happen with us also. Okay. External stimuli are absent in hallucination. Yes, external stimuli are absent in hallucination. External stimuli are absent in illusions? No. They are often present in illusions. But it is replaced by another stimulus. Okay? Understood? Any confusions here? I think there are none. Next. Hallucinations that occur during the transition from wakefulness to sleep are called hypopompic hallucination, functional hallucination, hypnagogic hallucination, or reflex hallucination. Transition from wakefulness to sleep. Yes. So most of you have answered it as C, which is hypnagogic. It is very easy to remember. This is something we did not cover in this class, but we will be doing it further in the extended course. Hypnagogic, you can remember it as going to sleep. Okay? So wakefulness, जागे हुए हैं और नींद में जा रहे, going to sleep, gogic. So hypnagogic hallucinations. If you're waking up, it will be hypnopompic. Okay? Okay, the term schizophrenia was introduced by Bleuler, Kraepelin, Schneider, Young. Now we have an error here, a small confusion here. Kraepelin is the person who gave the term dementia paradox, which is also another name for schizophrenia, but the name schizophrenia was given by Bleuler. Okay, and what did Schneider give? If anyone knows, what did Schneider give? Perfect. The first rank symptoms and also the second rank symptoms. Okay. The main feature of sensory distortion is dash, whereas the main feature of sensory deception is dash. Now, the real test. Excellent, guys. Excellent. Yes. When there is an alteration of a real stimulus, then it is sensory distortion. But when there is false perception or misinterpretation, it's sensory deception. Now make sure in questions like this you understand that यहाँ पे तो क्योंकि हमने उस order में पढ़ा था sensory distortion पहले पढ़ा था फिर sensory deception, it is easy to understand, but sometimes ulta also comes. Okay, so you have to be very very careful in reading the question in that time. ठीक है, और absence of stimulus होता है hallucination के cases में. ठीक है, तो पहला वाला ऑप्शन तो हो ही नहीं सकता. ठीक है. Okay. A hallucination occurring in the presence of a real stimulus in the same sensory modality is called Yes, we did discuss this, right? Oh, no, it will not be pareidolia ना. Pareidolia तो is an illusion. ठीक है? तो यहाँ पे तो क्वेश्चन में सीधा सीधा दिया हुआ है ना कि दिस इज एन हेलुसिनेशन, राइट? सो इल्यूजन, इसमें इल्यूजन और पैराडोलिया तो ऐसे ही निकल गया. बचा रिफ्लेक्स एंड फंक्शनल का we just studied about it, that there is fan and then there is also whispering thought. So real stimulus fan is present, but there is another stimulus as well. Okay, in the same sensory modality, दोनों सुन सकते हैं, दोनों सेम सेंस के थ्रू अंडरस्टैंड हो रहे हैं. ठीक है, सो दैट इज फंक्शनल hallucination. Understood? Any doubts with this? See, abhi we'll take the same example. Okay, we are hearing the sound of the fan, plus we are also hearing that whispering of a few people. Okay, both are the things that we can hear in the same sensory modality. एक ही modality है, hearing का ही modality है. ठीक है, ईयर की मोडालिटी हमारी, उसी में हम सुन रहे हैं दोनों चीजों को, बट दोनों चीजें डिफरेंट है. ठीक है, रिफ्लेक्स हेलुसिनेशन इज व्हेन one hallucination is happening in one sensory modality and other is happening in other sensory modality. We have not covered this yet, but if we are seeing something and hearing someone else, so that would be a reflex hallucination. Okay. Visual hallucination is in a visually impaired individual with preserved insight are characteristic of answer quickly, guys. Visually impaired individual को visual hallucination हो रहे हैं और preserved insight है, insight proper है. Delirium में insight नहीं होती है, there is clouding of consciousness. Okay, delirium tremens में clouding of consciousness होती है, alcoholic hallucinosis में भी clouding of consciousness होती है. बट हम यहाँ पे क्लियर कॉन्शियसनेस और प्रिजर्व्ड इंसाइट की जब बात करते हैं तो वो चार्ल्स बॉनेट सिंड्रोम हो जाता है. ओके, अगेन स्किज़ोफ्रेनिया में भी इंसाइट इज नॉट प्रिजर्व्ड. ओके, आई होप नाउ यू अंडरस्टैंड व्हाट चार्ल्स बॉनेट सिंड्रोम इज. A woman mistakes a rope for a snake while walking at night. This experience differs from a functional hallucination because wonderful, perfectly answered. The external stimulus is misinterpreted rather than accompanied by a hallucination. यहाँ पे percept occurs without external stimulation भी नहीं हो रहा. There is a stimulus which is the rope. Experience reflects a fixed belief. यहाँ पे कोई delusion की बात नहीं हो रही है, perception की बात हो रही है. ठीक है. The sensory experiences arise from memory rather than environmental cues. We have a cue. The stimulus is an environmental cue. Okay, so the answer is A. Ecological theory of perception is associated with, we started off with this. Great, lovely. Yes, it's Gibson. Gibson has given the ecological theory जिसमें वो बोलते हैं कि हमारा perception जो है वो हमारे environment से ही develop होता है. Whatever we are experiencing in our environment is leading to our perception. And this is it, guys. With this, we come to the end. And over to the team.
Yes. Thank you so much, Ms. Riya, for presenting the topic and covering it in so much details. I hope it was helpful for everybody. So if you can just let us know some feedbacks you might have for the session, that would be really helpful for us, because we try to keep the session a little slow only today. Not many heavy topics, not many heavy terms, because we are aware that there are some bachelor students also. So if you found the pace a little slow, if you found the pace a little fast, anything that you have the feedback, you can let us know, and we can like always incorporate such feedbacks in our further sessions. So if you can take a time and let us know some feedbacks, it would be really helpful for us. Still waiting for some more responses in the chat box.
Okay, function hallucination and synesthesia are two different concepts, although we have not discussed it, synesthesia in uh, this session today. Synesthesia is mostly when one hallucination leads to another hallucination. ठीक है, एक hallucination की वजह से दूसरा hallucination हो रहा है. Functional hallucination में दोनों hallucination एक साथ ही हो रहे हैं. Okay, so that is the difference. We will discuss more in depth when we come to that. Yeah, right. It's mostly sensations. It happens because of the drugs, hallucinogenic drugs which are used. उसमें synesthesia भी हो जाता है.
So I see some responses. The class was well paced, and if there are any other questions, you can mention them in the chat box, or you can unmute yourself. Okay, so there is a feedback. So we'll try to incorporate this in the further sessions. Thank you so much for sharing the feedbacks. And yeah, I think anything that you want to conclude with, Riya ma'am, or should we just end the session now? Thank you everyone for joining. And we will be sharing the further sessions, the biopsychology session, MCQ practice sessions, all the other sessions that will be happening in next week or next week. We'll be sharing them in the group itself. So thank you so much for joining, and I hope to see you in the next sessions as well.